Welcome to today's webinar titled TRICARE Coverage After Retirement from Active Duty, National Guard, or Reserve. Presenting today is Mark Ellis, Brian Smith, and Ron Peoples. They are TRICARE subject matter experts with the Defense Health Agency. I will now turn things over to our first presenter, Mark Ellis.
Thanks, Dan, and thanks to you and Military OneSource for hosting these seminars so we can talk to our valued customers, military beneficiaries, about their TRICARE benefits, how it works, and in particular, today's subject is about TRICARE coverage after retiring from military service. But first and foremost, I have to go through this disclaimer on slide number 2. So the appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, services contained therein. For other than authorized activities such as military exchange and morale, welfare, and recreation sites, the DoD does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this DoD-sponsored webinar. All right, got the legalese out of the way. The one thing I do want you to remember about the links that we've listed in the slides that you have before you or that you can download. Those are all linked to sites that belong to the military health system, and they do lead to bona fide, correct, and where we would like you to get information about your military health care benefits, and in particular, TRICARE. Moving on to the agenda, here's the things that we're going to talk about today. And as Stan said, I will do some of the talking, and then we also have a couple other folks that are identified. We also have other subject matter experts. If they chime in, they'll be happy to tell you who they are and where they work. One thing you'll note on this agenda is we don't specifically mention TRICARE for Life, which is the Medicare wraparound coverage when either you become eligible for Medicare either due to disability or age. While we're going to touch briefly upon Medicare, how you do that is the subject of a much more detailed webinar. And so for now, if you have questions about TRICARE for Life or anything that has to do with the combination of Medicare and TRICARE, we'd like you to go to tricare.mil/TFL. tricare.mil/TFL. All right, so let's go ahead and get started. So why do we want to do this presentation? Well, with the military beneficiaries, when they transition from one status to another, it typically requires a change in the TRICARE health plans that they were previously enrolled in. And so in particular for those that are on active duty, serving in the Guard or serving in the Reserve component, you must elect new coverage because the coverages between active duty or reservist is different than the coverage with retirees, and the retiree coverage is provided to family members. So that's the reason we want to talk about this. So with that in mind, I'm on slide number 4. There's 2 types of retirements. One is active duty retirement. These can be 2 ways. One, you can serve 20 years length of service, or you can be medically retired from a uniform service. Either one of those are 2 ways that you can retire from active duty. And then reserve retirements are a little bit different. National Guard and Reserve component members, they complete 20 or more years of qualifying service through a combination of either their reserve and or their active duty time. They become eligible for reserve entitlement. However, for medical TRICARE benefits, reserve component, National Guard Reserve members, although they have 20 years of service, they don't become eligible for retiree health care under TRICARE until they reach age 60. Note that some reservists may actually qualify for retirement pay prior to age 60, and sometimes people say, well, if I'm now entitled to retired pay, I must be eligible for TRICARE. The law doesn't specifically state that, and the law does say for TRICARE benefits, you have to be a retired reserve member with more than 20 years of qualifying service, but the medical benefits only kick in at age 60. Anytime a member retires from a uniformed service, whether active duty or for a reserve component member hitting age 60, that's what we call a qualifying life event. What that means is it's the opportunity for the retiring member and the eligible family members to elect to make a change in their coverage. And we give you specified time period, 90 days, to colloquially get her done. And so there's a link there to tricare.mil/life events that can give you more information about QLEs. Moving on to slide 5. So what changes when you retire from active duty, National Guard or Reserve? Your TRICARE eligibility and your plan options change. You and your family members will need to get new ID cards, and you'll pay retiree cost shares for care as opposed to what you previously did. Now, we on the slide there, it says tricare.mil/cost. That is an important link to know exactly what your out-of-pocket costs are going to change to from what your previous plan was to what you're going to pay as a retiree family and family members. Some of the benefits that active duty and selected reserve members currently enjoy are only offered to specific benefits to active duty or certain reserve component sponsors. The biggest example for active duty and selected reserve members is the ECHO program for disabled children is only available to active duty and selected reserve families. And the last and the most important thing, if I can't emphasize this enough, I will say it multiple times as well as the other speakers. You must elect to enroll in a TRICARE health plan upon retirement or for the reserve component members hitting age 60. There is no automatic entitlement to continue your TRICARE coverage. When I say TRICARE coverage, that means DOD is going to help pay for your health care costs when you see civilian providers. If you do nothing at retirement and you wait more than 90 days, we do have some issues we'll talk about in a little bit. The key thing here is you must make an election to enroll in a TRICARE health plan that best meets your family needs, a retiree health plan, and typically you have 90 days to do that, and we'll talk about some exceptions. Moving on to slide 6. Yes, in all these changes, please update the DEERS, the Defense Enrollment Eligibility Reporting System, to let us know that you've made a change. So you'll go to an ID card issuing office. You'll see the link there where you can find one. You can log on to MilConnect. You see the link there. You can call the Defense Manpower Data Center and they'll help you over the phone, or you can fax changes to the number listed on the slide. On the other hand, that's the eligibility piece. On the other hand, if you have questions about enrollment, call your regional TRICARE contractor here in the continental United States, or if you're overseas, to the overseas TRICARE contractor for assistance. For finding information what their phone numbers are, there's a link there for you. All right, so let's talk about what plans. I'm on slide 7. Let's talk about health plans that are available to folks when they retire from active duty. So there's two kinds of ways to look at it. So if the sponsor is under age 65, you're eligible to re-enroll in TRICARE Prime if TRICARE Prime is available in the area where you plan to relocate or live. You can enroll with the U.S. Family Health Plan. There's 6 designated areas in the United States where that plan is offered. You can enroll worldwide in TRICARE Select. If you're qualified for TRICARE for Life, if you've been deemed eligible for Medicare Part A and you purchase Part B, generally speaking, you may qualify to be in TRICARE for Life. And if overseas, we do offer both, we only offer TRICARE Select coverage. In the overseas area, there is no TRICARE Prime coverage offered to retirees and retiree family members. And finally, TRICARE Plus is a local military treatment facility enrollment option for primary care services only. If the sponsor is actually age 65 and over, the sponsor will be entitled to TRICARE for Life because they'll have Part A and they'll pay Part B premiums. Remember, for TRICARE for Life is individual coverage. So if the sponsor is over age 65, but the spouse and the children don't have Medicare Part A, either due to disability or age, over age 65, then they would be eligible to enroll in the plans to the left of the slide. Moving on to slide 8. So if you want to enroll in TRICARE Prime or Select with no break-in coverage, you must do so within 90 days of the date of your retirement date. The effective date of the coverage will be the day after your active duty ends. So it's the effective date of your retirement. Again, TRICARE Prime is only available in certain stateside areas. TRICARE Prime Remote, TRICARE Prime Remote for active duty family members, both stateside and overseas, are no longer available to retirees who retire from active duty. Now, we recognize that the Uniformed Services have had some issues in updating DEERS to reflect your eligible status as of your retirement date. And so we've made some special provisions for those retiring from active duty, as well as those retiring from a reserve component, to give you some additional time, because the TRICARE contractors cannot process your request for a TRICARE retiree health plan if DEERS doesn't reflect that you're eligible for such plans. So we recognize you may try to request your enrollment in a TRICARE retiree plan within 90 days of your retirement date, and you may be told by the contractor you can't. So let's talk about how that's going to work out. So we have made special provisions that if you can't get it done within 90 days, the contractor will request and process a retroactive request to enroll in a TRICARE retiree health plan up to 12 months after your retirement date. So in slide number 9, let's take a look at that. So like I said, 90-day qualifying life period. If it's been updated in DEERS, we certainly recommend that you do that as soon as possible so there's no gap in your coverage. Because the key thing about this is, until you can elect to enroll and the contractor can process your application for coverage, as of the date, your last date of active duty, from that day forward until you get enrolled in a retiree health plan, you actually have no coverage. And so we want to make sure that gets in as quickly as possible. And for those that don't have any problem, the Uniformed Service updated DEERS correctly with your retirement date. To avoid a gap in coverage, please do so as soon as possible within the qualifying 90-day period. So, and again, we'll have, you can do it up to 12 months after your retirement date. This applies to service members retiring from active duty, retired reservists turning age 60. And we also made a special exception for unremarried former spouses who become eligible for TRICARE coverage as their own sponsor. These are typically called the 20-20-20 spouses, but it's a unique situation where sometimes their update of DEERS or their eligibility for TRICARE as an unremarried former spouse is often delayed by the court's actions for getting updated into DEERS. On slide number 10, let's continue talking about retroactive enrollment. Coverage is effective on the date of your retirement date. If applicable, you must pay any enrollment fees back to your retirement date. We do not allow you to elect the date of the start of your coverage if your coverage is due to retiring. If you desire purchase care coverage, you must, and when you request it, you will be retroactively enrolled back to the date of your retirement date, and enrollment fees through that date of your request and 2 months further to get everything started will be needed from you in order to start your coverage. If you don't request coverage within 12 months of the date of your retirement, By law, you're only entitled to Space A care, space available care in military treatment facilities, hospitals, medical centers, and clinics. Space A means likelihood is you may not even get in, even if you're eligible for the care. So again, if I can foot stomp it one more time, as soon as DEERS reflects your eligibility to enroll in a TRICARE plan, if that's your desire, please do so. We do not want to have new retiree families and their family members shut out of getting care being cost shared downtown by DOD because you failed to do the enrollment within the time frames. With that in mind, I've covered my part, and I'd like to turn over to my colleague, Brian Smith, who's going to talk to you about coverage for those retiring from National Guard or Reserve.
Thank you, Mark. As he stated, my name is Brian Smith, and I'm the Program Manager for the Reserve Component Health Plans, Policies, and Benefits within the TRICARE Health Plan. I'm going to be going over various coverages available to those retiring from the Guard or Reserve in my segment. It's important to note that any selected reserve member that were to have TRICARE Reserve Select coverage during their time of active reserves, their TRICARE Reserve Select coverage ends the date upon retiring from the reserves. I also want to point out that when I speak about retired reserves, it does include Army and Air National Guard, and the reserve components encompasses all 7 of the Navy, Air Force, Coast Guard Reserve, as well as Army Reserve as well. So that being said, again, if you had TRICARE Reserve Select coverage prior to retiring from the reserves, then that coverage is going to end on your retirement date. And then from that date forward, depending on your age, you may be eligible for various TRICARE health plans going forward. It's important to note that any retired TRICARE health plan that you enroll in will be maintained by the costs that are associated as a retiree and retired family member. Going over to slide 12, as you'll see, TRICARE Retired Reserve is a health plan available to those retired reservists under the age of 60. This is a premium-based health plan where you would pay monthly premium in addition to an annual deductible and cost shares or copays. Would like to point out those retired reservists who do draw early retirement pay due to time and contingency operations when they were active, they will continue to maintain that early retirement pay if so. However, by law, the premium-free or regular TRICARE, i.e. TRICARE Prime, TRICARE Select, or what have you, is not available until the sponsor reaches age 60. Once the sponsor has reached age 60, like Mark pointed out, and I'd like to also emphasize, the sponsor must take action and then submit a request to enroll in either TRICARE Prime, if available, depending on where the sponsor resides when retiring, as well as TRICARE Select or TRICARE for life if you have Medicare Part A and B prior to reaching age 65, as well as a U.S. Family Health Plan if located in one of the 6 areas throughout the continental United States. And also, as Mark pointed out, while you are not eligible for TRICARE Prime overseas, you may enroll in TRICARE Overseas Select. And then lastly, as a retired reservist, once you reach age 65, you may obtain TRICARE for life coverage if, in fact, you have enrolled in paying Part B premiums. Over to slide 13. Again, just an emphasis on the retiring before age 60. As I mentioned, if you qualify, the sponsor and sponsor only family members cannot do so. The sponsor must submit a request to purchase TRICARE Retired Reserve. As far as qualifying or being eligible, law currently excludes those members, retired reservists, from purchasing TRICARE Retired Reserve if they are eligible for or enrolled in a federal employee health benefits program. If you do not purchase TRICARE Retired Reserve, you will not be eligible for any other TRICARE health coverage. You can purchase TRICARE Retired Reserve at any time throughout the year. There's an open enrollment for TRICARE Retired Reserve. However, if you, also as Mark pointed out, if you want no gap in coverage when you retire from the reserve component and enter retired reserve status and under age 60, you must submit your request within the 90-day time period of that qualifying life event. I also want to emphasize that if you are locked out of coverage, be it from TRICARE Retired Reserve or TRICARE Reserve Select, and you do not get that coverage reinstated within 90 days from your last paid through date, you may not purchase that coverage until the beginning of the next following year that occurs from the open season. So as it says here, is you don't have to wait till TRICARE open season to purchase TRICARE Retired Reserve coverage. However, if you are locked out, you will not be able to purchase coverage until the first of the following year that you were locked that you lost your coverage for failure to pay your premiums. So again, it's important to note, make sure you get that request for TRICARE Retired Reserve into your contractor within 90 days from the retirement. Over to slide 14. Once you do reach age 60, again, you must elect to enroll in a TRICARE health plan, be it Prime if in a Prime service area or TRICARE Select. If you've met these qualifications, and as Mark pointed out, also not only in the active component, but also in the retired reserve community, we are also aware that retirement processing is also held up at times. So once you actually have the retirement processed by your reserve component and have these following qualifications, you'll be able to go ahead and then enroll in either health plan that you choose once you reach age 60. One of those is to have the notice of eligibility to retired pay at age 60 from your service. It's also referred to as a 20-year letter. You are, in fact, now drawing retired pay. This is important. You should receive notice from your reserve component as well as DFAS 6 months out prior if you have an established retirement date to get the paperwork in so that you are actually drawing that retired pay once you do actually turn age 60. And then lastly, that your eligibility is reflected in DEERS accordingly. Again, as Mark pointed out, it is important that you constantly maintain and update DEERS as changes occur either in your military status or family composition. Over to slide 15. When you've met all these criteria, again, to enroll in TRICARE Retired Reserve, you must submit that request within the 90 days. I apologize. If we're talking TRICARE Prime or TRICARE Select. So once you reach age 60, you must submit that request within the 90-day time period. However, as Mark pointed out, we currently have an exception to where you can submit that request within the 12-month period of your retirement date. Coverage will be effective the date back to when you turn age 60. And again, as Mark pointed out, if you do not submit that request, be it within the 90-day qualifying life event time period or within the exception of the 12-month retro enrollment, you will only be eligible for care at a military hospital clinic if space is available. Otherwise, you will have to wait. If you miss all those deadlines, be it the 90 days or within the 12 months from retirement date, you will then only be able to enroll in a TRICARE health plan upon the next TRICARE open season. Over to slide 16, how you enroll in a TRICARE health plan. For TRICARE Prime or TRICARE Select, you will log into MilConnect. The link is there located below for online submissions for enrollment, and you would follow the prompts as far as benefits and then proceed to the beneficiary web enrollment. And from there, the option will show what's available for stateside healthcare plans only. Again, because overseas TRICARE Prime is not available. But for TRICARE Select, you'll be able to select that for overseas as well as stateside. By phone, you can also call your managed care regional support contractor and submit a enrollment request over the phone. You may also do so through the mail by downloading the form, which can be obtained at tricare.mil/forms. And then lastly, for those overseas enrolling in TRICARE Select, you may visit a TRICARE service center and do so in person. To learn more about enrolling in TRICARE in any health plan, we recommend that you visit tricare.mil/enroll. Over to slide 17. Again, as I mentioned briefly on the qualifications to purchase TRICARE Retired Reserve coverage, you must not, as a retired reservist, you must not be on any active order for more than 30 days. You should not be in the Transitional Assistance Management Program. And then lastly, you are not to be enrolled or eligible for a Federal Employees Health Benefits Program. That once you meet those qualifications, then you can proceed over to slide 18, and then to take the second step to purchase coverage. For TRICARE Retired Reserve, you may also go online at MilConnect with the link provided there, and also proceed through benefits and the beneficiary web enrollment to purchase and enroll in TRICARE Retired Reserve. It is important to note that the beneficiary web application, the beneficiary web enrollment application, is not currently available for overseas enrollment. Let me see here. You may also purchase TRICARE Retired Reserve by the phone by calling your regional contractor. You may also submit it by mail by accessing the request form, printing that off, signing and sending it in, as well as if you're overseas, you can submit that in person at the TRICARE Service Center. It is important to note that when you do purchase TRICARE Retired Reserve coverage, initially you will be asked and required to pay 2 months premium up front. This is because to allow for you're required to pay automatically each month for your monthly premium through an electronic funds transfer or a recurring credit card. And the required 2 months premium initially payment up front is so that that automated payment for subsequent months for your monthly premiums would take effect, and then you would not have any loss in coverage for your second month. That being said, that ends my portion of the presentation, and I'll turn it over to Ron Peoples for the overseas program.
Thank you, Brian. As Brian said, my name is Ron Peoples, and I'm from the TRICARE Overseas Program Office. And I'm here to echo what Mark and Brian have previously said. Retirees are eligible to enroll in the TRICARE Overseas Program or a TOP Select program if they live overseas. Again, only the Select program is available, not TRICARE Prime or TRICARE Remote Prime. So the only program that's available overseas to retirees is the TRICARE Select program. And it operates very similar to what TRICARE Select, how it operates here in the States, where you will have co-pays, cost shares, as well as a yearly deductible. So those things still apply. So you're familiar with how things work. You don't actually have referrals and authorizations all the time, but if you're admitted and there are special things that have happened in your healthcare, you may have to have a referral and authorization. But largely, the program operates the same as it does in the States. The real thing to remember is that this is the only program available to retirees who live overseas. And that's my portion, and I'll turn it back over to Mark.
Thanks, Ron. So on slide 20, let's talk about pharmacy. That's a key health component of healthcare benefits with TRICARE. So the good news is the pharmacy benefit continues as new retirees and new retiree family members. If you're enrolled in a TRICARE health plan, you have the pharmacy benefit continued. You can fill your prescriptions at military pharmacies if they normally carry that drug, or you can have the prescription filled through a mail order TRICARE pharmacy home delivery. There are some limitations overseas. You can have those prescriptions filled at an authorized TRICARE retail network pharmacy in the U.S. territories except for American Samoa. And you may fill them at non-network pharmacies or host nation pharmacies overseas, but be forewarned, there may be additional out-of-pocket costs for non-network or host nation pharmacies overseas. Your options for filling your prescriptions depends on the type of drug your provider prescribes and where you live. And remember, most military beneficiaries with TRICARE coverage, if your doctor has prescribed maintenance medications, heart medication, asthma, things that you take on a regular basis to help maintain your health, those typically have to be either filled through the home delivery program or at a military treatment facility. Any questions regarding the pharmacy program, please go to tricare.mil/pharmacy. There's a whole bunch of information relating to what the different pharmacy benefits, out-of-pocket expenses, etc. Moving on to slide 21, let's talk about dental and vision. So while you're on active duty or when you are a reserve component member and now you've hit age 60, the dental and vision options have changed for your families as well. And so retired service members and family members may qualify to purchase dental coverage through FEDVIP. For active duty family members and certain reserve component family members, you may have had dental coverage through the TRICARE Dental Program. The TRICARE Dental Program is separate and distinct from FEDVIP. So when you retire, that TDP coverage ends. And your opportunity to enroll in a retiree health plan option, we no longer offer, DoD no longer offers a TRICARE retiree health plan. As of last year, retirees and family members are eligible to enroll in FEDVIP, Federal Employees Dental and Vision Insurance Plan that's offered to federal employees worldwide. That's offered by OPM. And then also, vision coverage is made available to retirees, eligible family members, and active duty family members enrolled in a TRICARE health plan. They may qualify to purchase vision coverage through FEDVIP. Again, DoD does not manage nor run the FEDVIP insurance plans. They're run by the Office of Personnel and Management. But any questions or concerns about FEDVIP coverage, please go to benefeds.com, benefeds.com. So on slide 22, we've talked a lot about the TRICARE health benefit. We talked about eligibility, how to enroll, what plans new retirees and new retiree family members might be eligible for, and some differences depending on where you live and the type of plans that might be offered in those areas. So on slide 22, I want to emphasize tricare.mil is your number one source for authentic, no kidding, correct information about the TRICARE health plan. When I was on active duty, we often talked about people called barracks lawyers who would tell you, oh, this is the way it is. If there's any concerns about whether or not you think something is correct or not about the TRICARE military medical and dental benefits, please go to TRICARE.mil and use the word search to look up the term you're thinking about, and it will be displayed. And if you have further questions about the TRICARE benefit, you can always contact your regional contractor. So on slide 23, there's also resources that you can download, again, from TRICARE.mil /publications. These are by each health plan or a geographical area, and it's a great wealth of information, easy to read, information you can download and share with your family and friends as you transition from either active duty or turning age 60 as retired reserve component members, to understand what options you and your family members have as you make that election of coverage within 90 days if possible. With that, I think we're going to stop and take some questions. So Stan, let me go and turn the mic back over to you.
All right. Thank you, Mark. And also thank you, Brian and Ron. Let's get right into our questions. The first question reads, I understand Congress has mandated gray area reservist TRICARE premiums be at actual cost, which makes them very expensive for member plus spouse. Are you aware of any bill or discussions to address that, specifically before age of 60 gray area retirement?
This is Brian. This is Brian, and so currently there are no measures in Congress to either amend that to be it to where Department of Defense were to cost share monthly premiums, but current statute for the entitlement of TRICARE Retired Reserve does require the retired reservist to pay the full cost of the premiums, which are based off of actual costs for beneficiaries receiving care within the TRICARE Retired Reserve Plan. I will say that we always inform our beneficiaries, you know what your healthcare plan needs are best. So a TRICARE option may or may not be the best. We do understand, we as in the program office, that yes, the monthly premiums are fairly expensive. That being said, we do recommend that you go to your state exchange to see if there's a way that you might be able to obtain commercial health insurance that may or may not be subsidized by the government that would be cheaper than the monthly premium rates for TRICARE Retired Reserve.
All right, thank you. Next question. Oh, did you have something, Mark?
Looking forward to the next question. Thanks.
Okay. Next question. How do I elect when I go to Deers to get my ID card?
So hi, this is Mark Ellis. So as you're going through your retirement process with your military service, they will be able to tell you when the Deers has been updated. They've reported your retirement date. Generally speaking, in talking with the 7 active components and the 7 reserve components, generally they do not update Deers to at least the first retirement date paycheck. So typically there's at least a 30-day lag. But my response is talk to the retirement processing office of your uniformed service, and they can tell you best when to head towards a rapid site. Next question.
Okay, let's see. Question reads, when you retire from the National Guard after 20 years and are 40 years old, I want to use TRICARE prior to age 60. The TRICARE Retired Reserve, you say only qualifying members are allowed to use it prior to age 60, but there is no more information on what you need to do to be considered qualified. Please let me know what is considered a qualifying Guard member prior to age 60.
Okay, so this is Brian Smith again, and so regardless of if you're Guard or Reserve, once you actually retire, you are transferred into what is referred to as the retired reserves. So any qualification to purchase TRICARE Retired Reserve is if you are you are transferred into the retired reserves, you are under age 60, and you are not eligible for or enrolled in a federal employees health benefits program. So the case in point to this question, whether you're 40, 38, 50, once you have been by your component transferred to the retired reserves, that retirement is final, and you do not you are not eligible for enrolled in the FEHB, you should then be able to purchase TRICARE Retired Reserve. Next question.
Thank you. Next question reads, I didn't get notified when I retired about the 90 days. They said on the phone had to wait until this coming open season in November. Is this true?
This is Mark Ellis. Absolutely not. As we said, you can elect to enroll up to 12 months after your retirement date. Please, after this is done, please pick up the phone and call and talk again to the regional contract. And also make sure that your retirement date is correctly showing in DEERS. You can do that by calling the DMDC toll-free line, or you can call the contractor and they can look up whether or not you're eligible to enroll in a retiree health plan. So please do one of those two things. Recommend you do it right after this is done. Call the DMDC toll-free line or call your regional contractor and make sure that DEERS correctly reflects your eligibility to enroll in a retiree health plan.
Okay, next question. When you say within 90 days of retirement, do you mean you have 90 days after retirement to enroll?
Yes, and then we give special exemption up to 12 months after the retirement date due to the Uniformed Services may not be able to update DEERS in a timely manner. But yes, and remember, as I said earlier, until such time as you elect to enroll in a retiree health plan, you have no TRICARE coverage for helping you pay your health care costs when you see civilian providers. Because what the Uniformed Services do is upon your retirement date, your entitlement and eligibility and enrollment in an active duty or a reserve component health plan is terminated at midnight the date before your retirement date, right? If that is not done by the Uniformed Services and they do show you in DEERS as continuing in either active duty coverage or reserve component coverage, once the retirement date is loaded to DEERS, all those claims that were processed as active duty or reserve component under TRR or TRS will be recouped and reprocessed. So it's really, 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 really important that you work closely with your uniformed service or component to make sure that your retirement date is loaded into DEERS as quickly as possible. We recommend, and we've told the contractors to process your retirement request for application for retiree health care coverage up to 90 days prior to your retirement date. But we recognize at the moment the Uniformed Services are struggling to get it in even 30 days later after your retirement date. So this is something you have to work closely with your uniformed service to get the retirement date loaded to DEERS, and then as soon as possible, if desired, elect to enroll in the TRICARE retiree plan of your choice, and which is available where you live. Next question.
Next question reads, how do you avoid a gap in coverage? Do you know if there are any plans where the newly retired folks can enroll in the FEDVIP plan and have it start on day one of their retirement?
This is Mark Ellis. The answer is no. Brian Smith actually pointed out something earlier for reserve components, but it's certainly true for retirees. As of 1 January 2018, military beneficiaries have to elect to enroll in a TRICARE plan. That also means they can elect to not enroll. Who wouldn't enroll? Maybe somebody who retires from the military and is immediately employed by a large civilian employer who offers a very generous health care benefit that's provided premium free or cost less than the TRICARE out-of-pocket expenses for premiums and copays and deductibles. You may elect to not enroll in TRICARE because your employer is offering you a better deal. But no, there's no specific government-sponsored alternative to TRICARE upon retirement. You can elect not to enroll if you want, but again, if you desire TRICARE, make sure your retirement date gets updated and you promptly notify the contractor of your desire. Have your credit card at hand when you call. Next question.
Okay, thank you. What happens if you need care while DEERS is not updated with retirement date? Do you pay and ask for a refund?
So this is Mark Ellis again. So the answer is two. One, if indeed the Uniformed Services didn't terminate your active duty TRICARE plan coverage or your reserve component coverage on your TRS or TRR, those claims will actually process. But as I said earlier, they'll be recouped and reprocessed with retiree cost shares. When you retroactively enroll, the contractor is required by contract to go back and look at all the healthcare claims that have been processed since the retirement date, and those will be reprocessed. If they hadn't, if indeed though the services terminated your active duty or reserve component coverage upon your last date of entitlement under those two types of coverage, TRICARE will deny all claims. You'll need to keep receipts, bills, and then once your retiree coverage has been activated, retroactive to your date of retirement, you can submit paper claims to your regional contractor with copies of the bills, and those claims will be processed retroactively up to 1 year after the date of service through your retirement date.
This is Francine Forrestel, and I apologize. I work customer service here within the Defense Health Agency. On the question before that, there was a question about FedVIP, and we are currently aware that when a retiree chooses to purchase FedVIP coverage, there is a 1 month break in coverage, and that's basically because of how OPM policy processes enrollment. So if you enroll 1 month coverage, it doesn't start until the next month, and we can't see any way around that because coverage rules are different for us and how we look at eligibility and retirement versus the Office of Personnel Management. So you will always have that 1 month break in coverage.
And so for this, Mark, thank you, Francine. So remember, for FedVIP, that's vision and dental only. Good chime in. Thanks, Francine. Next question, Stan.
The next question reads, excuse me, I'm on TRICARE Prime and I'm on TRICARE Prime and using my wife's medical HMO. Will TRICARE Prime help cover the cost above the deductible? How much time do I have to file a claim after I receive my bill?
Hi, this is Mark Ellis. So you've asked a question commonly called in the trade is coordination of benefits. And it's when military beneficiaries have TRICARE coverage and they have a commercial health plan. Generally speaking, in most instances, commercial coverage pays first, and then TRICARE will pay up to what they would have paid had there not been commercial insurance that paid first. Generally speaking, civilian providers, you should always ask if you have two coverages, is to provide information to your healthcare provider what your coverages are. In almost every instance, except for health maintenance organizations, civilian providers will generally bill the commercial carrier first, find out what they cover, and then file a claim for the balance. For HMOs, they tend not to do that much, and so you'll need to get an explanation of benefits from your HMO indicating how much your out-of-pocket expense for the care you received, and then you'll have to file a paper claim with your regional contractor. Next question.
I am retired from the A&G reserves, and I'm also on Medicaid. I have more than 5 months in California. The rest of the year, I'm retired in Germany or the Canary Islands, Spain. When I'm not covered by Medicare, I do have secondary insurance and have listed TRICARE as my third medical insurance, who normally picks up the Medicare and secondary do not cover. If I have an emergency or just need to seek MT for a medical problem in those countries, will I be able to submit claims to TRICARE directly, or what would be the correct way?
All right. So if I understood correctly, you live part of the time in the United States and other places, and other times of the year you live overseas. And it sounds like that you have TRICARE coverage, but you also are entitled to Part A and are paying Part B. And so, generally speaking, TRICARE for life, and you're retired, no longer active employed. Medicare typically pays first, but Medicare will only cover for services provided in the continental United States. When you go overseas, TRICARE becomes your sole coverage, and you'll pay the normal TRICARE deductibles and co-payments overseas. And that includes U.S. territories.
Okay, thank you. Next question. If we have open referrals and pending medical treatments that will go past retirement date, what actions will need to take to ensure that pending procedures will remain covered?
This is Mark Ellis. This is a difficult one. So you need to get enrolled in a TRICARE retiree health plan as soon as possible. We don't have the statutory authority to direct the contractors to provide coverage when you're not enrolled in a TRICARE health plan. That being said, if you are enrolled in TRICARE Prime before retirement and you desire TRICARE Prime enrollment after retirement, by all means contact the regional contractor to make sure that the referrals and authorizations that were in place prior to, assuming your TRICARE Prime coverage is started, please contact your regional contractor to make sure that the previous referrals and authorizations are still in place to pay for that care. Again, though, if there's a gap in coverage, there's nothing at this point that we can direct the contractors to authorize payment for services from a civilian provider without actually being enrolled in a plan.
Okay, thank you. We are up against the top of the hour, so I'm going to read just a couple more questions before we conclude. Next question reads, retired reservist, age 59, turned 60 in December 2019. My daughter, under 26, without medical benefits from work, is covered under employer program in accordance with the ACA law. What is the TRICARE retire process for my daughter's medical, dental, vision when I use TRICARE retired benefits?
So this is Brian. If utilizing TRICARE Retired Reserve, you can purchase TRICARE Young Adult TRICARE Retired Reserve. Correct me if I'm wrong, Mark, there. But nonetheless, up to age 26, the TRICARE Young Adult program is also available for purchase for those dependents under age 26 through a retired reserve health plan, be it TRICARE Retired Reserve. But once you turn age 60, then also you could enroll her, and again, you're paying a monthly premium for TRICARE Young Adult, but in a retired Prime, if in a Prime service area, or TRICARE Young Adult Select. And so those would be the options for your daughter.
Hi, this is Mark Ellis. Let me chime in. So first and foremost, if for a young adult, the qualifying information is aged out of TRICARE due to age, under age 26, not married, and
no employers.
And not eligible or enrolled in employer-sponsored coverage through his or her own employment. If a former dependent child is over the age of 26, though, there is no young adult eligibility. The only plan that would be available to them leading up past age 26 is if they were enrolled in young adult and aged out a young adult, they could purchase our continuation coverage called the Continued Healthcare Benefit Program for coverage that would be up to age 26. But like some of our other plans, the premiums are not subsidized by the DoD. I think we have time for one more, Stan.
Okay, thank you. The question reads, I'm turning 60 in a couple of months, and I'm in TRICARE Retired Reserve and live in California. What would be the new program I would be in? I'm trying to figure out the cost of the new program.
So this is Brian. Once you turn age 60, if you haven't already done so, you need to be getting that retirement paperwork processed by your Reserve Component Personnel Office and Human Resources Command. Again, once you've turned age 60, if you reside in a prime service area, you can elect to enroll in TRICARE Prime, or if not, you can enroll in TRICARE Select. In order to determine whether or not you're in a prime service area, you can go to tricare.mil and or also contact your contractor, which is Health Net Federal Services, to have them assist you in determining whether or not you reside in that prime service area. So as far as costs go, it depends. And you can also go to tricare.mil/cost or tricare.mil/health plans to look those up. TRICARE Prime is an HMO where you will have all your care managed by a primary care manager, and you would pay enrollment fees for TRICARE Prime coverage. TRICARE Select, you would have a annual deductible as well as cost shares and co-pays for care rendered. And that should be it from there, Stan. Thank you.
Okay. That concludes our Q&A. Go ahead, Mark.
One last thing. So the quick answer for the gentleman, the last question is, to learn the differences between the various TRICARE plans and what might be offered in his geographical area, tricare.mil/plan finder will be able to help you compare and contrast what's going to be available to you as a retiree in your area. And with that, I'd like to thank Stan and the Military OneSource team for allowing the Defense Health Agency to spend this time with you to talk about TRICARE health plans that are available after retirement from active and reserve component time. And we'll turn this back over to Stan.
Okay, thank you, Mark. And I would like to thank Mark Ellis, Brian Smith, and Ron Peoples for sharing this important information. I would also like to thank our attendees for participating in today's webinar. If we did not answer your question today, please refer to the contact information in your copy of the webinar slide deck. Also, you can find many of the answers to questions about TRICARE benefits on the TRICARE website at tricare.mil. This concludes today's webinar on TRICARE coverage after retirement from active duty, National Guard, or Reserve. Thank you all for joining us and have a great day.